Hey everybody, Homoly here.
Oh,
What's going on, my friend? How are you?
Hey, good to see you. I love the palm tree.
Do you like that? I can't move too much or you can tell it's not real.
Yeah, it's same thing with me.
Here's the thing. The background creates hope. It creates light and it creates a future where I'm going to be when this is over. So how about that?
I agree. I love it.
Thanks, Paul. I appreciate that.
Hey, thanks for having me.
Today's kind of interesting, Paul, because we're, as it's obvious that, you know, you're an educator, you've been around a long time, you've been sharing, you've been a coach, a consultant, a great dentist. And as of probably February 29th, you had one approach. And what I'm really curious now, going on the other side of this thing, the approach that you're going to take, the mentorship and the leadership that you're going to deliver from your perspective. We've also had the opportunity to speak with a lot of Americans over the last couple of weeks with some pretty inspired conversation with definitely with Howard Duran was interesting. But it's really good to get a thought leader's perspective on how we can mentor our dentists coming out of this. There's a lot of fear right now. There's a lot of anticipation and a ton of rumor as well. So we want to sort of get a mentor and a leadership perspective on what that looks like from what you're delivering to your people. I'd like to welcome everybody back to UPB Dental Academy's Leadership in Times of Crisis. I'm here as always with Dr. Agatha Biss, and honored to have Dr. Paul Homoly joining us from the great USA.
Yes.
I actually did some of Paul's courses a number of years ago when I was working at a clinic. It was quite an inspired group, and the whole leadership team would spend half an afternoon 3 to 4 times a week, and we learned a ton. And Paul, welcome. Just give everybody a bit of background about yourself. We're just going to push the start and go button and take it from there.
Good. Well, I want to start out, Mark, by saying I love Canadians. As a matter of fact, a Canadian named Dr. Harold Robbins. I was recently right out of the Navy. I went right into the Navy following dental school. I was stationed at Cherry Point, North Carolina, at the Marine Corps Air Station. And I remember sitting in the operatory. I had about 6 months before I was getting ready to be discharged. And I loved being a Navy dentist. And I was reading a magazine about dental implants. And this is 1977, okay? And I thought, dental implants, you know what? That makes a lot of sense. If people can go to the moon, we certainly can replace a tooth without using a removable partial denture. So I signed up for an implant course at Tufts University in Boston. And it was a surgical technique course, a 6-day course. I flopped down in a chair. There was about 12 of us in the room. And sitting right next to me is this guy named Harold Robbins. He was a general dentist from Toronto, Canada. He and I became best buddies. We went through the program together. He invited me down to his office. I did my first implant cases in his office, Mark. I was in my late 20s. He was in his late 50s. And so he was kind of daddy to me. And he taught me implant dentistry. Oh, he got me started in implant dentistry and taught me practice management. So, you know, the first implants went in 1978. In 1979, if you remember, the law of the land changed. Now it became ethical and legal for dentists to market directly to the public. Remember that? And so I went right after it. Implant dentistry, the good news of dentistry, you know, and radio and television and newspaper. And my practice by 1982, 83 was really exclusive to implant and reconstructive dentistry. This is back in the early 80s. This is before it was cool. This is when there were still strong headwinds against implant dentistry. You remember those days, implants don't work and they're going to cause all these problems. Well, I was also enrolled at the Pankey Institute at the Dawson Center. So what I learned and what a lot of dentists learned very early on, if you want implants to be successful, you have to understand the biomechanics of restoring dental implants. And back then we were dealing with systems that were primitive based on what you have today. We were dealing with subperiosteal systems and ramus frames and endosseous blade implants. I didn't do too many blades. That made no sense to me at all. But I had a tremendous amount of success with the full mandibular subperiosteal implant when it's opposing a traditional removable denture. You could really control the forces of occlusion. And that's what made those cases successful. So for the next 15 or 20 years, I got involved with Carl Mish. I'm sure a lot of your viewers know who Carl was. Carl's passed, but Carl was, in my opinion, the most knowledgeable person in implant dentistry on the planet. He was amazing. But Carl and I and his brother and about 4 or 5 other faculty members helped Carl co-found the Mish International Implant Institute. I taught surgery and prosthetic there for years. I ultimately suggested to Carl, I said, let me teach practice management. Let me teach how to talk to patients. Because what would happen is that I would come back, it was a 5-session seminar, a workshop over a year and a half, and I'd speak at the first, third, and fifth session. And when I show up at the third session, I'd say, okay, by a show of hands, how many of you are doing dental implants? And we may have 200 people in the room, and one guy in the back would raise his hand.
Yeah.
And here they had the best technical training available worldwide. And yet they weren't doing it. It wasn't that they couldn't do it, it's just that they couldn't sell it because they were accustomed to, well, you know how it is, fees for partial dentures and removable dentures. Those fees are typically less than $5,000. This goes back several years now.
Mm-hmm.
But once you start dropping in implants and doing bone grafts and progressive loading and all that stuff, it can be $10,000 per quadrant. And so the whole process of how do you build relationships with patients, how do you make it easy for them to say yes? And I had a knack for that. 1995, 20 years into practice, Mark, I suffered an eye disability to my right eye and really lost my depth perception. Well, I could see well enough to do orthodontics or full dentures, but I couldn't do what I really loved, and that was restorative dentistry and implant dentistry. So I sold, scorched earth, sold the practice, sold the building, sold the equipment, out. So in 1995, I was, 43 years old, a 20-year career, and now I was, okay, now what? So now what for me was packaging what I knew to be true about how to get out of the way in the treatment acceptance process. How do you make the decision process simple for people? How do you understand what's suitable for people? How do you present complex care without overwhelming people or blowing them out of the water and losing them to sticker shock?
And I love, I think where you're going, and I want to make sure you touch on this. I love when you talk about the benefits versus the process, which is so common among dentists, right? We're not taught to talk about benefits in a simple format. We're taught to, present the nitty gritty details of the procedure. And that's where we lose our patience. So maybe,
right.
Can you talk about that a little bit? Because I'm really excited to hear that part.
We evolved away from educating patients to understanding patients. The typical case presentation kind of sounds like this. Agatha, you'll be my patient, okay?
Okay.
Okay. And let's say you're partially edentulous. Let's say, I know, perish the thought.
Drill
right?
and make it painful, Paul. That's all I can
That's
say.
right. That's right.
Already sold.
Yeah, sold. You're partially edentulous. You've got a daughter who's about to get married. You're mother of the bride, and your husband is he's a dispatcher for a large transportation company. He has a brother in Spain. All the kind of normal life events. Okay, so the typical treatment presentation process would kind of go like you come to the office, you check in at the front desk, and everybody's sweet, and then they call your name, you go in back, and the dental assistant puts you in a chair, shoots a bunch of x-rays, then she kind of whooshes you into the hygiene room. Hygienist looks at your teeth and talks to you about periodontal care because it's the foundation of the mouth, and she kind of pokes around and calls out numbers and kind of gets out the Cavitron and kind of bangs around. And then after that, then she rings the bell, doctor comes in, does an exam, calls out, okay, we need a crown on number 30, number 28, 29 are missing, we need an implant in that area, 7 through 10 are this, we need that. And so you're listening to, I need. Dentist gets done and says, any questions? You go, no. Dentist leaves, you look at the dental assistant, say, what the hell just happened? And she tries to re-explain everything. Well, and she gets into this process in her conversation. Well, we're going to make a small incision in the tissue. We're going to drill a hole into the bone, and then we're going to thread in a dental implant. We're going to put a healing collar on it. And then, 6 to 7 months later, we're going to uncover it. And then we're going to take an impression, and we're going to have an analog, and it's going to go to the lab, blah, 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 blah. And you stopped listening 10 sentences ago. So now you go up to the front, you talk to Ginger, the treatment coordinator, and she sits down and says $23,500. and you go, well, okay, I want to go home and what? Think about it. And see, you're not going to go home and think about it, Agatha. You're going to go.
Already did.
Yeah, you're going to go home and drink about it. That's what you're going to do. Okay. Now,
he knows me, Mark. He knows me.
That's right.
You've treated this patient before.
That's right. I have snuck and I've seen how you live. Yes. Okay. And I understand I dramatized that a little bit, but you kind of get it, don't you?
For everybody that's listening and watching, and I just love the way you describe it, but it's so true. But we're not, I mean, we're introverted to begin with.
That's right.
OCD, we're so, drilled, no pun intended, at school to be so precise with everything we do.
Scientific.
Time actually developing our people skills and our case presentation skills and just our connecting and bonding skills. So of course we, when we first come out, we really suck at this. So I love the fact that you talk on, in your programs about, teaching patients about the benefits first and really getting to know them and why they want what they're looking for, as opposed to just getting straight down into the dentistry and the money.
That's right. Okay, so let's take the scenario over again. Now what we're going to do is we're going to do it differently.
A whole new lesson. I love it.
A whole new lesson. So here we come.
Yeah.
Okay, so here comes Agatha. She sits in the reception area, right? And she fills out the paperwork. She sits down, and what happens? Dr. Homoly walks into the waiting room and introduces himself. Agatha, welcome to the practice. I'm Dr. Paul Homoly. Come on back. Let's get to know one another. I take you back to a consultation area, or maybe an operatory if a dentist said, but let's just say it's a consultation area.
Yeah.
And I look at your record and I say, well, Agatha, welcome to the practice. And let's say we're practicing in Scottsdale, Arizona. So Agatha, how long have you lived in Scottsdale? Well, we've been here, da, 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 da. Oh, really? You tell me about your family. You tell me about your kids. I tell you about my kids. And I said, so what do you do, Agatha? You say, well, I am an IT professional and I do this, that, and the other thing. I said, well, my wife was a natural gourmet chef and a nutritionist. So every time you tell me something about you, I tell you a little something about me. And so what we begin to do is we begin to relate as person to person, not doctor to patient. It's very important. Mm-hmm. And so I let that chit-chat conversation go for a little while. Then maybe about a minute into it, a minute or two into it, depending on how chatty we become, right? Some people are more chatty than others. Some people aren't chatty at all. That's okay. At some point I'll say, well, Agatha, what brings you in today? And you go, and you take your finger and you put it in your mouth. All patients do this, right? Well,
where has it been? It's like, ew.
Right? Yeah, you go, I don't like this. And so she's pointing to your front teeth. I don't like this. I don't like this. I don't like this. And see that space there and see this thing here and see that there. I go, terrific. Okay, I understand it. Aside from that, is there anything else? Well, I got this one area here on the bottom that, it's kind of sensitive to hot and cold. I really don't know what's going on there. I said, okay. Okay, so you're concerned about the front teeth, you're concerned anything else? No, it's been too long since I've been to the dentist and, I probably need a cleaning. I said, really? I said, what's kept you away? What's going on now that's important for you to have better appearance? Mm-hmm. You go, well, my daughter's getting married and I'm mother of the bride. And you know what? And I said, really? Tell me about it. Has she got her shoes yet? Has she got the dress? So now I'm going to start talking about the wedding. Because how important is the wedding to Agatha? It's her daughter. It's a big thing. So what I'm doing is I'm creating understanding. I'm not educating her to anything. What I'm doing is just understanding her. And while we're in this chit-chat kind of mode, I'm listening for those life events that she needs to fit the dentistry into. Mm-hmm. So are weddings expensive? Yes. Are they time-consuming? Yes. Right? So then I continued the conversation, and Agatha is an IT professional. I said, well, is your husband an IT professional? Oh, no, no. He's in the transportation business. As a matter of fact, we're flying to Portugal to visit his brother. Oh, tell me about Portugal. My wife is really interested in going to Portugal. Have you been there before? So now we know there's a wedding. She's IT. They're going to Portugal. So now we kind of talked ourselves out. And I go, okay, Agatha, I understand that your main concern is you want to look great for your daughter's wedding, and that you've got something going on there. Let me do this. Let's bring you in back and let me introduce you to my team. And let's see if we can't get you looking great for your daughter's wedding. And that, everything that I said takes about 5 to 7 minutes, okay? Once you know the structure of this interview, it's not a preclinical interview, it's kind of a get to know you kind of interview.
Total rapport building, right? It's like
exactly
rapport
right.
101. It's bridging, creating relationship.
Yeah, and notice I made no treatment recommendation. You know, most dentists, when the patient says, I don't like this, they're thinking, oh, maybe we should bond, or maybe we should do veneers, or maybe Invisalign. And they get all constipated on this. Well, how are we going to fix this kind of thing, you know? You know? So now we do a good exam. And during the exam, and we're talking during the exam, and first thing I'm going to look at, Agatha, is what your main concern is, right? I'm not going to start doing the perio thing on you because that's not your main concern. I'm going to look at your front teeth. Say, oh, I can see why you're not happy with this. How long you've had this filling here, and this tooth is kind of crooked. Let's take a look at the area over here. And then once I looked at the areas that you said you were concerned at, then I started looking at all around the mouth. And then when I find something that you didn't mention, I may say something like, you know, Agatha, I'm looking back over here. Did you know that you had a little bit of a gum infection back there? Did you know that? See, I'm not going to tell you that you have it. I'm going to ask you if you're aware of it. See, if I ask you, then it invites you to respond, and I'm going to get more, maybe a better history of the condition. Were you aware of this back here? No, I didn't. I said, well, you know, when I see this type of infection in other patients, I'm quick to warn them that we don't want that infection to spread to the other teeth, and we sure don't want it to spread it to the front teeth and ruin their appearance. Is this something you'd want to talk to me more about? Is this something you're concerned about? And so what I do during the exam is I identify those areas that you're not aware of. I ask you, I make you aware of them, and I could show them to you or just talk to you about them. But the important thing here is I ask you whether you're concerned about them or not. And I'm not trying to educate you into being concerned about them. I want to know if you are concerned about them. Okay, so now we're done with the exam. I know what you're concerned about. I know what you're not concerned about. I know why you're into the dental office, and I know those life circumstances that things need to fit into. Okay, is everybody with me?
Gotcha.
Okay, so now it's going to be, and let's just say that I'm going to present care following the examination appointment. I rarely do that for a patient that has got complex care. If I'm changing planes of occlusion, vertical dimension, condylar positions, or anterior guidance, if these cases, I may need to talk to the lab or the specialist. So I'm going to bring them back on a second appointment. But let's just say in your case, I'm going to present it. So now we're back in the consultation area. And now I'm going to present you care. It sounds like this. And I'm going to combine everything that I learned in our new patient interview with everything I learned during the exam. And I'm going to have my patient advocate. Patient advocate, that's what most dentists call their treatment coordinator. See, I would recommend anybody that's listening to this webcast, change the name. Treatment coordinator, that's your job label. Patient advocate is the value she brings to the patient.
Yeah.
Okay. So I'm going to have my patient.
It sounds like they're juggling too many things. Whereas
That's right.
That is just for this person, which is a whole different mind shift.
Exactly right, Agatha. Your instincts are exactly right on that. So I'm going to have Ginger, my patient advocate. Agatha, this is Ginger, my patient advocate. She is terrific. Ginger has been with our office for about 7 years now. She's the expert at helping our patients figure out their schedules and insurance and how they can best fit dentistry into their life. You and Ginger will have a chance to talk when you and I are done. Let's start with Let's start with getting your teeth looking great for the wedding. I know that's a real big deal for you there. My recommendation is going to be, when you're ready, for us to remove that dark enamel from those four front teeth and replace it with a new enamel-like material. Here, let me give you an idea. And then I'd take a little iPad and I would show you some before and afters. And then I would say, another thing you were concerned about was that sensitivity on your lower right side. Did you know you had a broken filling back there? Remember the broken filling I showed you? I said what I would do there is remove the dark filling, and I would put a porcelain-like material over that tooth. We call it crowning the tooth. That way it will be safe and comfortable for you. The third thing I want to talk to you about is, you mentioned to me that you'd like to avoid having that gum infection spread to other teeth. I'm going to introduce you to our hygienist, Rita. Rita's great. She'll help you identify the areas in your mouth that you need to be concerned about, and she'll show you how to deal with that. Agatha, the last thing I want to talk to you about is something you told me that you're not concerned about. That's that missing tooth on your lower left side. You said you had that tooth removed years and years ago from your family dentist. I think his name was Dr. Homoly. Even though you're not concerned about that missing tooth, I want you to know that I am. And when you're ready, my recommendation would be to replace that tooth with a dental implant. It's an easy procedure. The implant is in the gum, part of it sticks through the gum, and we put a tooth right on it. What I've done here is what have I done? I have presented the benefits of care.
Yeah.
I suggested that we need to fit this in with the wedding and your trips and all of that, right? And then I presented concerned conditions first. I presented unconcerned conditions second, right? That's not the sequence of treatment.
Mm-hmm.
Right.
See, that's the sequence of influence.
Yeah.
Okay.
So, Paul, when you have the counterintuitive thinking of a traditional typical doctor who wants to sound smart and speak smart and often talk themselves out of treatment, what I'm hearing right now, you've created rapport, you've created a relationship, you've shown all the benefits. How do you convince the doctor who is maybe for the last 5, 10, 15, 20 years done it polar opposite to that? What's the process that you've got to do to shift their thinking?
Yeah. It's the old, when the student is ready, the teacher will appear. There are huge headwinds against the type of thing that I'm talking about, because we are so bound up in the culture of dental school and continuing education. Mm-hmm. Come on, some of the most renowned educators we have, and you know who they are. They're on all the A-circuit speakers. When they talk about, treatment acceptance, what do they preach? Educate, educate, educate. And you get the whole trade side, touting, well, use this technology, show them videos and show them simulations of their mouth. And I'm all for technology. I'm not an anti-technology guy. Patients who need significant dentistry, they want it. The question is, does it fit?
Yeah.
Does it fit into our life? And educating the patient how to fix their teeth doesn't change their fit issue.
But it's interesting, the whole process you're talking about, I'm very much a systems girl, right? So I'm literally packaging as you speak, the steps, the flow chart, because that's how I function in my head. So what you're talking about is actually, by force, we're going to have to go back to that, because with the COVID thing and all the pre-screening that we have to do, we're actually going to have these conversations with our patients first before we dive into presenting and treating and all this stuff. And in a way, I'm really excited to speak with you based on that, because I think a lot of people need to go back to these types of conversations and really get to the core of why these people are calling our office, right? It's not just, hey, if you're coming in for a cleaning first. No, let's figure out what it is you want, pre-screen, have a conversation, triage, I guess, in some ways, figure out where they belong in your schedule and your life, and then go, how can we do this? How can we make this fit your life? But also, how can we do as much as possible, for example, in, one appointment or 2 appointments, so that you're not constantly coming in every 2 weeks for something new. Right.
Well, it's terrific, Agatha, that you bring this up, because what I did prior to this webinar we're doing, I kind of put down kind of 6 steps that are structural, all right?
Do a flow chart together.
A system. We'll do a flow chart together. That's right. And let's talk about the new normal. Let's talk about what's going to be different post COVID-19, now that we're coming into practice. Well, let's start with something that exists. Here's step number one. Step number one. Okay. You can make your flow chart. Okay.
Yeah, I already started.
There you go. Step number one. Here's something that existed prior to the coronavirus. Number one is that most dentists don't recommend complete care out of fear of overwhelm or losing patients to sticker shock. How do I know that? I know that because for over the last decade, when I would do my seminars, I would do anonymous polling where dentists who were in the audience could answer questions anonymously on their cell phone. I would ask this question, Agatha. I would ask, how many of you are fearful or reluctant of offering complete care out of fear of overwhelming patients or losing them from sticker shock? It's mid 70s, mid 70%. Okay. So let's start with the fact that most dentists don't recommend complete care. Okay. So that's it. Okay. So now let's get back to this coronavirus thing. Okay. So now what are we going to do differently? Here's what I would do. I would, in that new patient interview, remember when I interviewed and we talked about your wedding and the things of your daughter's wedding, I would introduce you to the concept of complete dentistry very early. Agatha, you know, things have changed in medical care and in healthcare. One of the things that we've become aware of is that we need to be very careful that we identify any dental condition that you have that could aggravate any pre-existing medical condition that you have. Now, there'll be some conditions that I'll identify that you may not choose to treat. That would be your choice, but I want you to know that I don't have that choice. I have the new responsibility of protecting you. Okay, everybody get that? Okay.
That's powerful communication, yeah.
Yeah, so that's step number two. Introduce the concept of complete dentistry before you do the exam. Tell them, I'm going to talk to you about everything. The reason I'm going to do it is I want to keep you safe, right? And this goes to redefining the concept of complete dentistry. And you know the definition of complete dentistry, the minimum amount of dentistry to restore patients back to maximal function, comfort, aesthetics, and airway. Well, what I'm saying is that that definition is no longer enough, in that the new post-coronavirus definition has got to be the minimum amount of dentistry to restore patients back to their optimal function, comfort, aesthetics, airway, and systemic safety.
That's huge.
Okay. Number three. Here's the third thing. This is your flow chart. Okay, Agatha? Number three, dental regulatory agencies and associations have established guidelines for preventing the spread of coronavirus during patient care. And we're probably all reading the same thing from ADA about PPEs. What I read in Canada, I have Canadian clients, and the Canadian colleges are recommending that after a patient leaves an operatory, that operatory is allowed to sit for 2 hours.
Three,
depending on the province, yeah.
Oh my goodness.
Yeah.
The point is that there's guidelines in place to stop the spread. Number four, point four, these guidelines, they diminish the efficiency model of modern dental care. You know, the efficiency model is multiple patients simultaneously, right? Get a patient in every chair, delegation, get hygienists and expanded duties auxiliaries, plus the turnaround time of dental operatories from one patient to the next. That turnaround time is going to be greater because of sterilization. And number five, okay? Recommend that the best treatment for the patient is to provide complete care in the fewest number of appointments possible. Agatha, you said it 3 minutes ago, right? So what we want to do, it's kind of like we're almost back to old school, one chair, one patient.
Yeah.
You know, and when you think about it, the most profitable way to practice dentistry is one patient in the chair all morning and all afternoon.
Mhm.
You sit there with 2 dental assistants, a lab guy, and you just grind like hell. You'll be more profitable that way. You see, the coronavirus is going to give dentists the nudge. It's going to give them the excuse to sit down with people and say, I'm going to recommend complete care to you because I
It's
want to
true.
keep you.
Yeah.
Do you see the wisdom and the truth in that?
I love this, Paul, because I find that if you've, seen anything I've ever done before, I am very, very protective of dentists and our reputation. I feel like we're always, attacked from every direction. And this is our opportunity to do exactly what you're talking about. And I love
Yes.
it. Now we're finally going to be looked at as, professionals and out to take care of our patients. And it's not about the money. It is about delivering proper dental care in the least amount of appointments with the best outcome, the most long-term outcome. And so I love the fact that we're talking about this because we've had so many interviews in the last couple of weeks that were literally attacking, the dentist and what we've done. So this is like such a nice message to send out.
And it's great that the whole paradigm shift was organic, as you alluded to, Paul. This
Right.
happened because of coronavirus. We've hit the reset button, and maybe we are taking it back to the old school, the full appointment, the one chair, the more profitability. We've always thought on the same lines. We've had that same level of thinking, Agatha and I, as far as how treatment's presented. And I think this is great. The information you're giving is fantastic. It's going to resonate with a lot of people, almost because they're going to be forced into doing it. And now they're going to need the expanded knowledge on how to do it properly.
Yeah. Right. Step number 6. Here's the last step. While staying within the standard of care, let me preface this. Within the standard of care, provide the maximum number of procedures per appointment. This will help compensate for the dental care delivery inefficiencies brought on by regulatory agencies, right? So if you're in one operatory with one patient and a couple of assistants, now you bundle, there's the word, bundle procedures. So that's going to change things.
What I want to know is now you get to be the daddy to.
I'm daddy. I get it.
Yeah.
So what's your message? The good news of dentistry.
Yeah, the good news is now more than ever, treatment planning and offering complete care is more important than ever. Actually, it's easier than ever because COVID-19 has given us the excuse to do it.
Yeah.
And the whole piece with fear is like the phantom, right? The fear is an illusion. Dentists get fearful because they present care from a process-centered point of view. It's you need this, you need this, you need this, and there's no understanding on their part of what patients are concerned about and what they're not concerned about. Agatha, when I did the role play with you and I recommended the front teeth, fixing this tooth, but I said you weren't interested in replacing that back tooth. Remember that? I said, but I want you to know that I am. When I quote your fee, I'm going to quote the entire fee, including this tooth. And I'm going to tell you, Agatha, your total treatment fee is $13,500. Now that includes replacing the missing tooth. I know you're not concerned about that now, but I want to give you the whole idea of your treatment. If you do go ahead with everything, your total fee without replacing the tooth is $9,100. So I'm going to quote the big fee for all conditions. Then I'm going to quote the fee for concerned conditions. Does everybody see that? But the patient now has had the opportunity of learning what complete dentistry. That's the big message here. And patients quit practices. I'll tell you why. And you know this to be true. Patients quit practices because we over-educate them to unconcerned conditions.
Yeah.
You need a bridge? No. 6 months later, they come in for hygiene. Are you ready for the bridge? No. 6 months later, you ready for the bridge? No. 6 months later, don't talk to me about the bridge. Right? And you write in the record, don't talk to the patient about the bridge. 6 months later, broken appointment. And you think, low dental IQ. No. You see, when fit issues exist, fit issues are those life circumstances of budget and travel and all the complexities of patients' lives. When fit issues don't allow patients to get complete care, too much patient education feels like sales pressure.
Yes.
All right. So that's the big message, is that
this is a monumental conversation today because you've answered the biggest question. How are we going to do this? How are we possibly going to practice with these new conditions? And you have made it so concise so simple and so matter of fact that it just makes automatic sense. You've answered the biggest question in dentistry right now, I think.
COVID-19 has given us the excuse to present complete care. Here's the rub. If we don't present complete care, I think an argument can be made for practicing below the standard of care.
It's negligent. Yeah.
You see what I'm saying? Is you pick up your cell phone and you text the word leadership. Text leadership to the number 55444. Text leadership to 55444. And what you're going to get is a sample lesson from my online program that's really designed on how to present complete care with no fear of losing patients from overwhelm or sticker shock. Now, and if what I've said to you today about not presenting complete care may be below the standard of care, does that ring true for you guys?
Absolutely.
I love that. I love that because people need to, or dentists, I guess, need to understand that it's our responsibility to present it. If the patient chooses not to do it, that's a whole different scenario, but it's our professional responsibility to deliver that kind of conversation. And then essentially they get to make the decision whether or not they're going to follow it.
That's right. And what they don't just treat now, well, you save till later. But, you know, I'm not at all suggesting that if you do it this way, every patient is going to say yes. No, they're not. But
more will than before.
Yeah.
But you see, you won't lose the patient. You see, sticker shock is inevitable, but losing patients isn't. And when you present care based on, you know, I know you got a lot going on in your life now, Agatha, you got your daughter's wedding, you get the trip. You see, when you empathize with their life circumstances, they may not be ready for care, but they'll never forget how well you offered it.
Mm-hmm.
And when they become ready, where do you think they're going to return to?
Exactly.
Right. And now we're back to old school. It's called planting seeds. And I heard that freshman year in dental school.
Mm-hmm.
Right. We're kind of back to that.
Wow. This, you know what? I'm hearing a global sigh of relief with a lot of dentists who are watching this right now, because like I said earlier, Paul, the biggest question is, how are we going to practice? How are we going to present treatment in the quote unquote new normal? And the education you've given us today is going to be invaluable going forward. Paul, personally, I can't thank you enough for taking the time to share with us today.
Instead of paying lip service to complete care dentistry at study club meetings, actually begin to offer it. When this coronavirus acute crisis goes away, when we have a vaccine, so whatever that's going to look like, I don't know what it's going to look like. When the crisis goes away, what I hope remains is my words that offering complete care is the new standard of care. That would be a legacy that I would accept.
And maybe that's why this happened.
Yeah. Offering complete care is the new standard of care. Paul Homoly, Dr. Paul Homoly, thank you so much for your time today, your amazing insight, great education for not only Agatha and I, but our whole audience. We definitely appreciate you. Thank you.